Taking care of a patient, especially geriatrics, is not an easy job. Geriatrics are one of the categories that they are really in high risk of fall. That's why we are here today with my colleagues to show to you the medical procedures and how to take care of them and how to provide and maintain the safety environment and their privacy. There are a lot of medical procedure that has to be done when taking care of the patients. The first procedure that we are going to show to you today is how to do the bed bathing for the patient. Bed bathing is very important to the patient. This is the right time to assess the patient's skin through inspection if there's any redness or any bed sore in the skin of the patient. Now, I will show to you the things that we need to use during the bed bathing. Here are the things I needed for the bed bathing. The first one is the towel, a washcloth, cotton balls, and also a gauze for the eyes of the patient. I have here also toothbrush, a comb, and a shampoo. And of course, we should not forget the warm water that we're gonna use for bed bathing and the big towels and a gown. The first part in this procedure is how to clean the face of the patient. But of course, we have to inform the patient the procedure that has to be done. And before that also, we have to make sure that we did hand washing, which is very important to prevent the spread of microorganisms, especially during this pandemic. So now, Mom, I want to remove the mask because I need to clean your face. Show the mask. I have here the cotton balls with warm water. And then this will be used for the cleaning of the eyes of the patient, which is supposed to be from inner counters or from inside to outside. From inside to outside, of course, to prevent also the spread of microorganism. And then once used, throw. After the eyes, the face. And this washcloth is the one that we're going to use for the face of the patient. Of course, use warm water with the washcloth. Take a towel. And all the procedures that we are doing, we have to really make sure the privacy also of the patients and then the safety environment of the patients, which is very important. The side rails, the part that you're not using should be up, the side rails is on, okay? So now, I will be proceeding to the washing of the hair of the patients. So here, I have the shampoo and the warm water. So the shampoo on, put it, the hair of the patient, and gently massage it. And this will help also to the circulation of the head of the patient. And then pour the water. Okay, don't forget the back. Pouring the water. And after that, the cloth to wipe it. Pat dry the hair, including the back side of the head. Don't forget to put the used towel in a soiled linen place. And also, it's very important to remove the gloves in any procedure that we are doing. Dispose the gloves and use another gloves. Now, let's proceed to the changing of the diaper. Of course, as we all know, it should always be ready, all the equipments or the things that we needed for all the procedures that we are going to do. So now, I have here the diaper. Make sure that it will fit the patient's size. And also, a towel, a drape to cover the patient. Make sure that we are maintaining the safety and privacy of the patient when we are doing this procedure. Now, our Dr. Jinan will be coming with me here to explain to you the changing of the diaper.
تبديل الحفاظ طبعا شيء مهم بالنسبة للمسن. الشيء المهم أنه ننظر إلى المنطقة الخاصة ونبعد الحفاظ القديم ونطالعه كويس أنه ما في أي التهابات أو أي شيء ثاني، وثم بعدين نبعد الحفاظ وننتظر نجلب السبراير، نغسل السبراير المنطقة بماء فقط، لا نستعمل أي صابون أو معقمات ولا أي من هذه القطع اللي فيها مواد حافظة، فقط الماء. ثم نجفف بالقطع الخاصة مال الجسم نستعملها، ونعيد نحط الحفاظ الجديد. بعدها ننتقل إلى تسبيح باقي الجسم بعد ما بدلنا الحفاظ، وهنا نبعد الملابس القديمة ونضع وسائد على الجانب حتى نقي المسن أثناء قلبه على الخلف للأمام أو للخلف حتى لا يتضرر. ونبدي بتسبيح جسمه باستعمال التاولات، ومثل ما قلنا نستخدم المي، نحاول نقلل استعمال الصابون، مي وزيت، قليل من زيت جوز الهند فقط. الصابون نكتفي به مرة واحدة في الأسبوع يكفي جدا بالنسبة للمسن وطريح الفراش. كثرة استعمال الصابون ممكن يولد لنا قروح سريرية، هذا لازم ننتبه له. الشامبوات مال الجسم أيضا تولد لنا قروح سريرية، فما نحتاج استعمال الكيميكالز بالمرة، بس مي وقليل من زيت جوز الهند ننظف الجسم وننشفه، ونبدأ بتقليب الشخص على الجانب. راح نحاول أنا الممرضة 1 2 3 بهذه الطريقة، نعد 1 2 3 ونقلب، ننظف الخلف ثم نرجع المسن بعدها إلى الجانب على ظهره، ونفعل نفس الطريقة للجانب الثاني. بعد ما انتهينا من تسبيح الجسم تغيير الملابس، الآن نحاول نغير الشراشف التحتانية لأن تبللت. فنبدأ أول خطوة نخبر المسن بأنه احنا راح نبدأ تغيير الشرشف، فنبدي نحسب له 1 2 3. نطوي الشرشف بهالطريقة ونخليه تحته، ونرفع جانب السرير تمهيداً لعمل الجزء الثاني. الجزء الثاني حالياً راح نشرح كيفية نقل المسن القادر على الحركة بس غير قادر على المشي، فقط يستطيع الحركة وأحياناً يستطيع الوقوف أو لا يستطيع لكن غير قادر على المشي. فراح نشوفكم هذا الجزء كيف ننقله على الكرسي إلى الحمام حتى نسبحه وليس على الفراش. يلا راح نحاول نوديك للحمام نسبحك، ساعدنا شوية. يلا أول شيء نقعد الحافة السرير، هذا أول جزء. ثم الشخص اللي دا يهتم بالمسن يكون لابس حزام خاص، هذا متوفر في جميع الصيدليات طبعا ممكن يستعمله. نطلب من المسن أن يدخل إيده داخل الحزام، هنا يمسك بالحزام ايديه اثنينهن تمام. ثم يقوم جليس المسن بسحبه من تحت منطقة الجلوس، تحريكه إلى الكرسي. بعد ما انتهينا من تسبيح المسن وجلوسه ننتقل إلى إعطاء الأدوية طبعا والفطور. طبعا في أدوية تؤخذ قبل الفطور وفي بعد الفطور، طبعا كل حسب أدوية السكر، أدوية الضغط. فهاي علبة خاصة ننظم بها الأدوية لمدة أسبوع، فيها الصباحي، فيها نون نسميه بعد الظهر، فيها ايفنينج المسائي، وفيها قبل النوم before bed. 4 أقسام ولمدة أسبوع: ساندي، ماندي، توزداي، وينزداي، ثيرزداي، فرايداي، ساترداي. ترتيب الأدوية أما يكون من قبلنا بالإدارة نرتبها وننطيهم إياه بالبيت، أو نعلم الأشخاص إذا الشخص قادر على الفهم والاستيعاب ويعرف لغة إنجليزي ويضبط الأدوية، ونكتب على الأدوية وهو يرتبها بالعلب مع متابعتنا حسب الشخص اللي دا يهتم بالمسن. الآن الفقرة الأخيرة بالتأهيل جليس المسن، العلاج الطبيعي. راح نأهل الشخص اللي يهتم بالمسن كيف يقوم بالتمارين اليومية للمسن تحت إشراف أخصائية العلاج الطبيعي مارجي بولانز، هي اللي تتابع الأمر وتعلم التمارين وتوجهه كيف يسوي التمارين اليومية له بحيث ما يفقد المسن عضلاته، بالرغم أنه ما يستطيع الحركة بس نخفف عليه الآلام وما يفقد العضلات.
For the geriatrics, it is important to have them exercise in a regular basis. So it is not needed to be like very stressful exercises. It is just consistent exercises that will make them move their body so that it will enhance the blood flow. So especially for a bedridden geriatric patient, it is very important because it will enhance it will maintain the general body condition of the patient, as well as preventing the occurrence of secondary complications such as contractures and deformities of the body. It will also prevent the formation of pressure sores, which is a very undesirable result of being bedridden for a long time. So for a patient that is bedridden, we can start exercising from the legs, because if we start from the hand, it will directly increase the heartbeat of the patient, which is more harmful for the patient. So we should start from the lower extremity, so from the toes to the ankle, to the knees, to the hip joint, to the hand, to the elbow joint, and to the arms, to the shoulder joints. And then if there is still the patient is not in pain, we can also do exercises for the neck areas as well as the breathing techniques. If the patient can understand us, we can tell them to just do the breathing technique. This is also important, like if you want to change the exercises, like from shifting the exercises from the toes to the ankle, in between there should be interval. So the interval should be like 10 or 5 times of breathing, like inhale and then exhale. Breathing exercises is also important for the patient because it will facilitate the hygiene of the respiratory system, which in the long run, if the patient is not hygienically good in the respiratory system, it might develop pneumonia. Because nowadays, especially during this COVID season, pneumonia is the most common cause of death among the patients who are suffering from COVID. So for a normal patient, like a bedridden patient, it is very important for them to maintain the respiratory system in a clean way. So chest tapping will also be done, but it should be noted that when you're doing the chest tapping, the patient should have eaten like 30 minutes ago to 1 hour. Otherwise, if we do it very soon, it will induce vomiting to the patient. So now, we will start the exercises from the toes. So as I've said, we will start from the smallest joint. So we will just do the flexion and then extension of the toes. So the flexion and extension of the toes, we can do like that. So see that I'm holding from the toes, and then flexion, extension, flexion, extension. So now, we are on the knee joint. So the action of the knee joint is the flexion and extension as well. So we will do flexion and then extension of the knee. See, I'm maintaining the range of motion of the patient, thus preventing any contracture or tightness of the muscle. So after we did the 10 counts of hip abduction and adduction, we can move on to the hands now. So the hands, it can close and then open. Close and open. So we will also do this for 10 times. So this is, if the patient's hands are very tight and it will not open, do not force it. Just open it like one by one and do the exercise. So for the hand, the thumb motion also is very important. So we will do that extension and flexion of the thumb. Then after the hand, we can proceed to the wrist joint. So for the wrist joint, there's also flexion and extension. So we will do that also. And we will also have the radial deviation and ulnar deviation. So all of these exercises can be done 10 times. After that, moving on to the elbow joint. So elbow joint, flexion and extension also. 10 times again. And then after that, we can move to the shoulder joint. So for the shoulder joint, we will do the abduction and then the adduction. You can do like that. And then also flexion and then to the bed. Just remember that some of these patients will not give their hands to you freely. Some of them might resist it. So if the patient is resisting the motion, don't force your movement. Just go along with that range that they are giving, and then eventually, if you will do the exercises regularly, you will gain the motion. Then now we will move to the exercises of the cervical joints. So these are the cervical joints. So we will also exercise. So like looking up, looking down, looking up, and then down, up, down. This one also we can do for 10 times. And now we will make the patient go side to side. So like touching the ear to the next shoulder joint, from to the right and to the left, alternately. These exercises are very important for the patients to maintain them physically. So with the increased circulation, a lot of things can happen to the patient. It can prevent, as I said before, it can prevent pressure sore formation, tightness, and contractures for the patients. Okay, there's one more less exercises that should be done for a bedridden patient, which is very important to them. This will prevent the formation of the pressure sore itself. So it will be the trunk rotation. We will put the patient's leg in the knee flexed position, and then we will rotate the patient's body to the right, and then now to the left. So this will exercise the hip joint as well. So remember to make these exercises 10 times each at one set. It depends upon the patient. If you can see that the patient is tired, do one set. If the patient can do more, you can do 2 sets. But there should be like in between exercises, let the patient breathe in and breathe out for 5 times.